Hello, everyone, and welcome back. I can't just say welcome back to Heart for the Community Initiative because this evening is a collaborative between Heart for the Community Initiative, Enough, and Carl's Conversations. We wanted to put this on as many platforms as possible so that as many people as possible could be exposed to what's about to happen this evening. So, listen, let me tell you. I have Miss Mary Chamberlin with me this evening, and she's no stranger to our show. She's with us this evening from the Rappahannock Area Health District, part of the Virginia Department of Health. And she's going to be giving us some really current information about COVID-19, not only in our health district, but also in our state. And so it'll be an opportunity for those of you who have questions and comments. And let me tell you, Mary, I'm not sure if I told you this or not, but the last time you were on, Tisha and I have some friends who were really on the fence about vaccination. But after they got information from you, they decided to go do it. And they got vaccinated. And
That's
so,
wonderful.
yes. And so we're very thankful. So for those of you who are on with us now, please take a moment to begin to share this broadcast onto your pages, because this is really important information, and these are not opinions. Mary Chamberlain is going to bring us some facts, okay? And the questions that you ask, believe me when I tell you, she's ready for them. Now, we're going to answer your questions with as much information. If she does not have the factual information, we'll make arrangements to get back to you. But I want you to have very good confidence in what we're about to engage in. We're going to get real factual information. And we thank God for Mary. She is so responsive to us. When I say us, I'm talking about my buddy Gary Holland, who is also a board member with me in a group called Enough, and he's also part of the board of directors for Heart for the Community Initiative. And so we just thank God for Mary because she's awesome, and she's going to be giving us some information. So good evening to you, Mary. Welcome back to the program.
Hi, Carl. It's good to be here. Thanks for having me back. Who knew we'd be talking about COVID-19 now? I thought we might be talking about birds in the snow or.
When we first did this in 2020, I did not think that in 2022 we'd be still talking about it. But here we are. We're in it, and we have to deal with it. We're trying to climb our way out of it. And that's why we've invited you. Hopefully, something that you share today can help someone. I know that many people are very confused about information. I think I want to start there with you, if you don't mind. I get kind of frustrated, to be honest with you, when I hear people say they're confused, because the first thing I'm thinking is, what are your sources, right? And please don't tell me you're listening to people who don't have expertise in this field.
Right.
And I know that politics has had an effect on that. And I don't even want to get into that. I'm sure you don't either. We just want to deal with the facts, right? But I'm just telling people, I don't care what your political persuasion is. Makes no difference to me. Makes no difference what your religious persuasion. None of that matters. This is a virus that is not discriminatory at all.
It is not.
And so, as far as you know, what do you think is the confusion with the mix up of information, and what can we do to get ourselves straight, to get the right information?
So first of all, the purveyors of misinformation, Carl, are very, very aggressive. They're very strong in the way that they put information out. They're very strategic. There's a lot of manipulation that goes on, especially playing on people's fears when it comes to emotion, very real fears. And I've learned along the way in my role, never to judge people who fall prey to that misinformation, because again, it is very confusing, and you don't know who to listen to or who to believe. And sometimes the misinformation that's presented in the form of manipulation, it looks like it's from a really credible source. Maybe there's somebody who was interviewed, there's a tape someone's watching, and the person really seems very authoritative and they know what they're talking about, and it can be very, very confusing. I totally understand that. So one of the things that I've told people all along of course, being with the Virginia Department of Health, we follow guidance from the CDC. And even that aside, the CDC, FDA, the bigger government agencies that we've learned to trust through our whole adult lives, I say talk to your doctor. I always tell people talk to your doctor, because that's the person that knows you the most, knows you very intimately, and wants you to be healthy. They care about your well-being sincerely. It's not just some random person on the internet. So I always tell people to go to a source you trust, who also has the expertise behind them and knows what they're talking about, and that would be your medical professional.
Absolutely. I'm so glad that you said that. I've been saying some of the same things. I tell people, hey, listen, start with your family doctor. Yeah. And if you are a person who has some of those very well-known precursors, diabetes, heart disease, high blood pressure, liver disease, any type of pulmonary issues, you need to be talking not only to your primary care physician, but you need to be talking to all of your specialists. They know you, sure. They know your specifics. And so when you're hearing on this particular program or that particular program that they're hiding these treatments and that treatment, well, you can bring it up with your physicians who know you, right, who would know whether those particular treatments would be beneficial for you or not.
Yes, absolutely.
Yeah, I work in a hospital, and I'll be careful what I say, but it's surprising some of the things that we see and hear. Let me tell you that.
I do understand.
And so I do thank you for getting us up to date on that. I think the main thing that people want to know is, where do we stand, especially in the Rappahannock Area Health District, mm-hmm. and furthermore in the state of Virginia? What is our current status with the COVID-19 virus, with this Omicron variant? Where are we? Where are the numbers trending? Have we hit our peak? So I'll just ask you to begin to catch us up, and anything I can do to help you explain it, I will.
Thank you. Yeah, lots of goodies packaged in that. So where we are now, we are still experiencing historic highs as far as case counts, hospitalizations, not deaths. I'm very, very happy to say that, which to me is a very strong testament that the vaccines are working. So with the Rappahannock Area Health District, one of our very trusted sources is the University of Virginia Biocomplexity Institute. It's a mouthful. Their information is actually on the VDH dashboards. They put out a weekly report, and there's projections in that. And they explain how they come to the predictions that they're making, what they're factoring in. And what they're projecting is that we will see a peak in the state of Virginia on or around January 23rd, which is kind of right around the corner, maybe to the end of the month, early February. I've heard some other sources, but we're close. We're close to reaching, we feel, what will be our peak. Our numbers, I just learned this morning from our own data team, a great, very optimistic metric. Our case counts this week compared to last week are 51% lower. That's a big deal. That's a lot. Unfortunately, I will couple that with saying that we are still, again, at historic levels. So we were really bad to the nth degree. Now we're just really bad. So we're getting there. We're seeing progress. We've also seen hospitalizations coming down in our area the past week, which has been very good. Again, record hospitalizations too. So we're trending, fingers crossed. I'm saying that not as firmly as I want to. I'd like to see 7 to 14 days of continued decreases across the board before I'm comfortable really saying we're trending. But it does look a lot better this week than last week. So I'm going to take that. So when you think about a peak and you think about, say, a graph, if, we shot up, right, with our case counts, and very, very sharply. And so as we come down, we're still going to be hitting those high numbers on our way down. They're not going to be all of a sudden amazing numbers. But again, seeing a good trend of decreasing numbers 7 to 14 days out will be very, very promising.
All right, awesome. So as far as getting the word out, educating the populace, I'm sure you guys deal with this. As far as the demand for vaccinations, boosters, and education, are we seeing great interest? Are we making any progress and getting a greater portion of our population educated about this thing, tested, vaccinated, and boosted?
Great questions. We're getting there. I would certainly like to see our boosters, our percentage of boosters higher in our area and the state overall, but definitely in our health district. I think one of the problems that we're running into is that so many people are becoming infected with COVID now, with the Omicron variant being so highly transmissible, that whether they have a mild case, which most people do when they're fully vaccinated, or a little more serious, they feel that, you know what, I've had it now, I don't need a booster. I have natural immunity on top of being vaccinated. And you know what, I understand why people would think that, because normally when we go through life, we get something, we feel like, oh, I've had it, I'm immune to it. COVID isn't like anything else we've dealt with in the past. So we have to break from those thoughts, and it's hard. But we know that there is some natural immunity that comes from having COVID, from being infected, but it's not enough to prevent serious illness and unfortunately even death. So those are the studies that have come out more recently, and it's important to try to relay to people the message that the booster is really important. We are dealing with a different variant than even Delta, the variant before. And you know what? If you've had your 2 doses or your 1 dose with Johnson & Johnson, it's just 1 more shot, just 1 more dose. If it gives you that extra layer of protection, which it does, then go for it. Go ahead and get that booster. We are seeing our community vaccination clinic, which is here. We have one here in Fredericksburg in Central Park. We are monitoring those numbers, those doses, and boosters are the predominant dosing. Most people are going for boosters. So I feel encouraged that the message is getting through to people. It's a little bit laggy at times. I wish they would have all rushed out right away, but I'll take it. So we're getting there.
All right, we have our first question from Tisha Armstrong. She wants to know, are we going to need yearly COVID-19 boosters?
Hi, Tisha. That's a great question. And the answer is we don't know yet. Research from, again, very trusted sources says we may, just like the flu, vaccine. Every year, a lot of people may not realize this, but every year the flu vaccine or combination of vaccines that's kind of put into one is based on predictions of what strains will be around that following year. So a lot of science, obviously, a lot of thought goes into that. So we could very well come to a point where we're getting annual boosters, just like the flu, in anticipation of new COVID variants. So we don't know yet, but there is a possibility.
All right. So when we talk about the vaccinations, I know there are still questions with people. They want to know, is one vaccination shown to be more effective than the other? I know right now the big 3 are the Johnson & Johnson, the Pfizer, and the Moderna. Mm-hmm. Are there any others outside of that? And out of those that we know and use, are there any of them that are shown to be more or less effective than the others?
I think the mRNA vaccines, the Pfizer and the Moderna, are showing in studies to be more efficacious. They're stronger. They provide stronger immune response. So I know a lot of people, even personally, who initially got the 1-shot Johnson & Johnson vaccine, and then when they got their booster, they chose an mRNA. that is another conversation that I think is a great one to have with your own doctor, because they can speak to you about it, especially if you have any underlying issues or concerns or allergies to anything. There's just a host of reasons to talk to your doctor before making that choice for yourself.
All right. Now, here's one thing that most people want to talk about and want to know. This Omicron variant, what is making it so contagious? And as contagious as it is it appearing to be more deadly or less than the other variants that we've seen so far? And what can we do about it?
So this is something it's great questions, and something I've struggled with outside of what I do in my role as a public information officer, as a regular person. How do I understand mutations and variants and what it all means? The easiest way I can explain a new variant and how it can form, how it can be created. The more people who aren't vaccinated globally, and in the United States, of course, the more opportunity a virus has to keep infecting. And then as it keeps infecting, it has a chance to mutate. Viruses are live entities. They want to live. So they're going to find ways to survive, and they evolve very quickly, or they can. So in the case of a new variant, you've probably heard of spike proteins when it comes to the SARS-CoV-2 virus, which is the one that causes COVID-19. So those little spike proteins are, when you see all the little graphics and pictures that represent COVID, they're the little things sticking out like a ball. Mm-hmm. So with Omicron, you actually have more of those spike proteins that have been created during a mutation, that have developed. And so those spike proteins are what attach to our cells to make us sick. They are attached to our respiratory tract, all kinds of things. And the more that there are, the more opportunity the virus has to infect us. So I think that's probably the easiest way to explain it. So that's what happened with Omicron. Now, one of the things we've been hearing, which has been, unfortunately, in my opinion, dangerous information, a dangerous description of Omicron, is that it's more mild. It's not mild. It is less severe. And you might think potato, that does make a difference. Mild is the word that people will pick up on and run with and think, it's nothing. It's just a cold. And it can be just cold-like symptoms for people who are fully vaccinated and even boosted, because they have that protection. If they, for people who aren't fully vaccinated or boosted, they're filling up our hospitals. So we know that it's not a mild variant. So yeah, that's probably the best way I can explain Omicron.
Got it. Now we have a question here. Rachel Taylor is asking, how soon should a person take the vaccine after experiencing COVID-19, and which shot is preferable?
Great question, Rachel, and one we actually get quite a bit. So it used to be way back in the beginning, it seems like forever ago, it's been 2 years, but it seems like 10, that we had to wait a certain amount of time after a COVID infection before getting a vaccine. Now, as long as you are no longer symptomatic, you can get your vaccine. Which one is preferable? Well, again, that's a really personal choice. So if you want to talk to your doctor about what they feel is best for you, or do some research, CDC has an excellent page. They have so much information breaking down, so does the FDA, breaking down each of the vaccines and how they work and their benefits and their efficacy. Some people just really do not want 2 shots for their primary series. And so the Johnson & Johnson is what they prefer. Johnson & Johnson is not recommended for certain people based on some issues that have arisen. They're rare complications, but they can happen. So again, it's a very personal decision. But if you've had COVID and you're no longer symptomatic, you're feeling better, definitely talk to your doctor and go ahead and get vaccinated.
All right, wonderful. Now, this may be a little sticky, but people want to know. Mm-hmm. Now, we hear, and like I said, I work at a hospital, so,
Right.
but I want your expert information. So some people are discouraged by the vaccine because they're saying, listen, I'm going to get the jab, I'm going to get the boost, but I'm still most likely going to end up with COVID at some point in this thing. So
Right.
what's the point? Now, you just made a point a few moments ago
Mhm.
about those who are vaccinated are less likely to get sick enough to go to the hospital, less likely to die. And I
Yes.
will tell you from what we're seeing at the hospital, the vast majority at the hospital where I work, the vast majority of those who are hospitalized and fighting for their life with COVID are those that are not vaccinated.
Yes.
Can you verify the information? I know you may not have national numbers, but you definitely have district and state numbers. And I'm talking about factual information. Could you speak to that, please?
I do. And actually, Mary Washington Healthcare we have 3 hospital centers here in the Rappahannock Area Health District. Mary Washington Healthcare has a Fredericksburg hospital, their main campus, and they also have Stafford Hospital. And then we have Spotsylvania Regional Medical Center. Mary Washington, having 2 hospitals, is a larger healthcare center, and they have been really good about putting together a daily chart that breaks down their hospitalization numbers and little people in different colors that show who's vaccinated as opposed to who's not, and fully vaccinated. So fully vaccinated is the 1 dose J&J or 2 doses of the mRNA. And they're even now including people who are boosted. And you can see the huge discrepancies in those numbers. It's predominantly people who are unvaccinated, not fully vaccinated. And then we've got different levels of severity too. Somebody could be hospitalized and showing up on that chart, but then there's people who are in ICU, and then there are people who are on ventilators. The chart does break that down as well. So there are varying degrees of severity when you're not well, or you're not well enough to be hospitalized. You're sick enough from COVID to be hospitalized. So as far as I'm going to get it anyway, what's the point? For me, this crosses professional and personal. I do not ever feel that the risk is worth it. I just don't. You don't know how your body will react to COVID, the virus that causes it. You just don't know. And it doesn't seem to be a risk worth taking. So it's just so easy to get vaccinated. So many people have been vaccinated by now globally in the United States. It's safe, it's effective, and we are constantly encouraging people, if they haven't been vaccinated, to get vaccinated. And if they've been fully vaccinated, to go ahead and get that booster.
Right. Here's another comment by Rachel. She says, I have a few friends who have been vaccinated and boosted and are having a rough go at it. Recently, 1 death. And Mary, I do know, I was just gathering some information yesterday in preparation for this show. And from what I understand, and you let me know if our data in Virginia backs this up, from what I understand is that the people who are getting seriously ill and dying who are vaccinated and boosted are the people who had real issues with pre-existing conditions. Maybe they had, these could be HIV patients. These could be patients who are immune suppressed, like going through chemotherapy, uncontrolled diabetes, liver disease, kidney disease, heart disease, COPD, pulmonary issues. That's my understanding. Do the numbers bear that out here?
I can't speak to underlying conditions. That would be further research I would have to do. But I can say in general, nationally, that yes, that's correct. People who are affected in the worst ways, the most severe ways, do unfortunately have underlying issues. Some people who are immune compromised or have autoimmune disorders. And if you look at the statistics too, the people who have the more severe disease, we have a lot of people who are elderly. So they've been, fully vaccinated and or boosted, but they still end up pretty sick in the hospital. So there are some factors that play into that. And the bottom line is, in the end, that nothing is 100%. It isn't. And it wouldn't be fair for us or any other trusted source to say that the vaccine is 100%, that there's, it'll protect you no matter what. But again, not getting vaccinated, not getting boosted, you're rolling the dice.
Right. And here's another, this is Ivory Morris. I agree with Rachel, the same. People are still having a rough time, even with vaccinations. We're seeing that people without underlying conditions are still passing healthy people. And I don't want to sound like I'm trying to defend the vaccination. I'm not. I'll just state what I know to be true. Once again, we know that, just like Mary said, there's no 100% efficacy. I think the best numbers, I can't remember whether it was Moderna or Pfizer. I think it was like a 94 to 95% efficacy, which means that, you're going to have 4 or 5, 6% of people who do get vaccinated and boosted who will still develop, serious illness with the virus and may even die. And of course, that's not good news to us. We losing family members. I would just say for myself, let me put myself back on the screen. I sound like a ghost voice here. I would say for myself, knowing full well that I am vaccinated, I'm boosted, and that is not 100% guaranteed, but I certainly feel better knowing that I have done everything that I can do, along with the mitigating factors. I constantly wash my hands. I try not to put myself in risky situations. I'm masking and doing the things that I know to do to stay safe. And I know that many of you who have people who are sick, they're doing the same things, but there's nothing 100%. But like I said, for me, I absolutely feel better knowing that I have done my part. And I think Rachel is saying the same things,
Right. And Rachel, you have an excellent point there, to keep yourself safe, but also the people around you. This is about all of us. It's a community effort. It's a global effort. And that's a tough message to sell to a lot of people too, unfortunately, that it's not just about me. It's not just about you. It's about all of us collectively. And Carl, you touched on something really important, that you don't get vaccinated and boosted and then just go about your life without practicing other safety mitigations. We're just not there. So it's really, really, really important that we all take all the precautions necessary. You can still live your life. We've all found ways to adapt these past 2 years. And on a little side note, some of those adaptations are actually nice, so we've had to think differently about how we live, what we're doing, and think about the people around us if we weren't already doing that, which unfortunately many of us maybe haven't been. So yeah, there's a lot of, right now, you just have to wear a mask. If you're in public, you have to wear a mask. And, even outside, if you're ever in a situation where you're in close contact with other people, because you can be in a crowd, like over the holidays, there were things, people still go to concerts, there are outdoor venues, they might travel to a warmer climate to do it, or vacation. You still have to be careful. So don't just think just because you're outside that you're fine, you're safe. You still need to take every precaution that you can. So, and even those of us who do everything right, check all the boxes. Yes, this is a serious virus. And unfortunately, there will be people who are affected who have done all the right things.
Yeah. Iris has another question and statement. I know several people who have had negative effects from the vaccine itself. What about this? And why is it called a vaccine when it is an mRNA?
Negative effects from the vaccine itself. So there are side effects from any vaccine, of course. Some people, I had a terrible time. After my first shot, I got Moderna. It was okay. Second, I was down for the count for a couple days. I kind of planned for it. Nothing lasting after that. And, to be transparent, I've mentioned before on your show, Carl, I have lupus. So I have an autoimmune disorder, and I expect that I'm going to have certain reactions. It's usually my body that's reacting, not whatever was put in. The mRNA is not a new process. It's not a new technology, but it's being used in a new way. It's been amazing. As a matter of fact, mRNA is now being looked at for like the pneumococcal vaccine, for delivering other vaccines, especially to parts of the world where it's tough to get people vaccinated. So I've been really encouraged with mRNA vaccines, and I didn't know anything about them until COVID, and I took on my role here and learned a lot. But it is a vaccine, and it's really important that, again, if you have questions about the vaccine and how it's made, or concerns about safety, talk to your doctor, but also do a little research. You can look at the FDA, CDC. They're actually really transparent with studies and clinical trials. If you really want to get deep into those, and you can understand the language, it's all there for you. There's also the adverse reporting. Most of it that's reported, there is a very small causal effect that's been confirmed. So like if I were to say, I just got my vaccine and now my left big toe is green, it has to be that because I just got the vaccine. Those are kind of weeded out over time. There's not a direct correlation, even though I might think there is. So that's something to consider as well when we talk about, any kind of lasting side effects.
Thank you. And here's Iris again. And I'm going to take a crack at this before I give you the microphone. Also, if you have underlying conditions, does it even make sense to get the vaccine when you have a high probability of severe illness that may lead to death? Since all deaths when ill with COVID are caused by underlying conditions. Iris, I'll tell you this. I have a couple of underlying conditions also. And I think that we probably said this at the top of the interview. You have to be in contact with your primary care physician and or your specialist for those underlying conditions. I was very skeptical of the vaccines when they first came out. And remember, I work in healthcare. I am not one who just trusts things like this. I'm certainly not one who believes that everything that the government says is right. So the first thing I did was dig up all of the information that I could from every reliable source that I knew of. I work with physicians. I work with nurses and all kinds of specialists. I was talking to those people. My main source came from my primary care physician. And I scheduled some time. I sat down and talked to him. He explained some things to me, and he said to me, "You, Mr. Armstrong, most definitely need to be vaccinated, and you need to be vaccinated now." So that's what really helped me to make my decision. Now, my wife was a little different. Hers had to come differently because of some of her situations. So it was listening to our doctors that helped us. And now I'll be quiet and let Mary handle this.
No, what you said was excellent. It's and again, speaking even more personally than professionally, with an autoimmune disorder, anything that goes in my body is a risk for me of having a flare of my immune system. I want it to stay quiet. I want it to sleep. I don't want to energize it. So anything that goes in, kicks it into gear, and it's always a risk. And it's just, I kind of cringe, like, oh, but same thing. My doctor said, because, believe it or not, I wasn't one of the first people to sign up, even when they had the opportunity. I wasn't. I just kind of wanted to see, I'm a regular person too, and I just wasn't really sure. And then I thought, well, I work from home and I'm not really out much, and my husband works from home, and, we'll be fine. And then the opportunity arose where I could get it sooner than I thought I was ready, because I was actually at an event kind of working, and then someone didn't show up for their vaccine. This is when we had to sign up in the very beginning. And it was, "Oh, Mary, do you want to get your, okay." So, but I'm so glad I did, and yes, my doctor said the same thing, that, you please get your vaccine. And if you're not getting it, just find a closet in your house to make comfortable, decorate, whatever you need to do. And I decided that I didn't want to live in a closet, so I got my vaccine.
Right. Here's another question from Tisha. She says, "What happens if a person is symptomatic for a long period of time, if they are, or if they're a long hauler and can't get the vaccine as of yet? What then?"
That's an excellent question, and that goes a little outside of my scope of subject not expertise. So, but I would say, again, that's a great conversation with a doctor, but we're just learning about long COVID more and more now than we did before. It's actually even a disability for some people. It's very complicated. Even just before coming on to speak with Carl and you all tonight, I did a little more research because there's so much new information every day. And the Journal of American Medicine says that there between 10 and 30% of people who've had COVID develop long COVID. Now, long COVID is defined. I don't know if it's a tight definition yet, because I know there haven't been a lot of real concrete definitions for it because we're still learning. But for the most part, it's symptoms 4 weeks or more out of your initial infection. And what's frightening about long COVID, even more to me, is that you could have had COVID with no symptoms at all. Maybe you didn't even know you had it, or maybe you tested positive, but you were asymptomatic, or very mild symptoms, and then gone on your way, and then later on start developing long COVID symptoms. That's just really frightening. Like I don't, certainly don't, I'm not an expert. I don't understand how that works, but we're learning more and more about it all the time. As far as having long COVID symptoms and not being able to get vaccinated, again, that's a complex medical discussion. However, if you're not experiencing the acute symptoms of the initial infection, my understanding is that you would be able to get vaccinated again, provided your medical professional said it was safe for you.
Well, I tell you, I live with a person with long COVID, and it's not pretty. And it is so new until, like you said, the doctors just don't know everything. And these people who have long COVID, they're case studies. That's the way it is.
It is. And again, we're learning more and more as we go, but I think it'll be years down the road where we're learning even more and have more definitive answers.
Right. Here's what I want to ask, and I'm sure there's some other people who have this burning in their belly. We know that the CDC recently reduced the quarantine time to 5 days. That's been in effect now, from my understanding, for a few weeks. Are we seeing any data in our district, in our state, that suggests that the 5-day quarantine is having a positive or negative effect on our mitigation efforts?
That's such a great question. And I will say that I don't think there's a way to know that now, just because we're in such a surge. It's so chaotic with numbers right this minute that I don't think we have a quite enough baseline to be able to gauge that. The reason the CDC decided to make that change was with the new variant, with Omicron, we're finding that the infection period can be shorter, and it's at the very beginning of the exposure, as opposed to Delta. It took a few days to reach the most infectious period. So there's also, I know everybody's read this. It's allowing people to live their lives and work and put bread on the table, and healthcare providers can be in the hospitals where they're needed. Provided they're not, they don't have symptoms, they're feeling okay, there's no fevers. There are some conditions to the 5 days. So that's important for people to understand as well.
Right. Also, Omicron, what effect do we know that it's having on our infants and smaller children who are not yet approved for vaccination? And are we getting any closer to getting approved vaccinations for that younger group?
More great questions. So in our specific area, our data team, who's excellent, by the way, ran down some numbers for me today and for the past few weeks. We're not seeing a big increase in serious cases, severe cases, enough for hospitalization of children. We're not seeing that. I've read nationwide we're seeing more hospitalizations, or I hear it on the news. we're not seeing it here so much. As a disclaimer, our Mary Washington Hospital Center, who again puts out the most reported data for us to see, which is excellent. I so appreciate that. They don't have pediatric COVID patients in their hospitals. So if a child is diagnosed with COVID and is serious enough to be hospitalized, they'll go to a pediatric hospital up north or in Richmond. So that would be, again, more like comprehensive digging to get that information. But so far, knock on wood, we're not seeing that here, that it's more serious. As far as the when a vaccine might be available for the younger set, haven't heard anything definitive on that yet. Just know that with the 6 to 12, or no, I'm sorry, 5 to 11, and the 12 to 15, those came fairly quickly. I'm assuming that with the clinical trials, they're being very, very cautious and conservative with the younger set. So which I appreciate.
Wonderful. I'm not sure if you just covered some of this and I missed some of the answer, but I'm going to ask the question.
Sure.
Ivorus wants to know, why is it 5 days where you're still contagious? So we're just spreading it even more. No symptoms does not mean you're not contagious.
So great question. But so we're talking about, you're talking about, I think, isolation, and the 5 days is for quarantine. So if you're a close contact, if you and I were together, we had lunch, and I called you and said, I just popped positive, and you were with me for more than 15 minutes in this little space and we weren't masked, then that's quarantine. So that's 5 days. And it can be, and you wear a mask up to 10 days. If you are positive, if as your friend that had lunch with you, I have to isolate for 10 days. That's different. Now, if I'm symptomatic, if I'm asymptomatic and I've been fully vaccinated and boosted, then I just have to wear a mask wherever I am for that full 10 days, unless I'm symptomatic. So again, there's some variation in there. It gets a little tricky, I know, and it has changed. And there are also different employers who have different protocols, different standards, regardless of what the CDC says. Some of them are more stringent than the CDC. Some might be a little less. The important thing, again, to remember is to try to put yourself in a position at this point, especially in the surge that we're in, where where our risk of becoming infected or infecting someone else is very low. We just always have to be thinking about our environment and how our behaviors are affecting not only our own health, but the people around us.
Amen to that. I love Iris. Thank you, sweetie. Keep it coming. She says N95 masks are now being recommended because the cloth masks are just not cutting it. And these people are coming back after 5 days that are still contagious and are wearing these masks. Well, I tell you, I was actually at the hospital. I'm non-clinical, but there are times I have to go into the clinical areas to perform my job. And it was one of the nursing managers that looked at me. She says, I was wearing a cloth mask. She says, does that mask have filters in it? I said, no. She looks at me. She says, the Omicron virus is going to get you. You need a surgical mask. I stopped what I was doing. I went and grabbed a surgical mask. I put it on, then I put the cloth mask on top of it. Mm-hmm. So that's what I'm doing now. I don't wear the N95 very much, but the surgical mask and then the cloth mask. And I was told that is sufficient. Now, once again, I'm a non-clinical worker. The clinical workers in our hospital are required to wear the N95. Right. But I want you to address Ms. Moore's concern here, if you don't mind, Mary.
It's a great, it's a great topic. It's a great question. A great statement. So this is all fairly new too. I actually just shared all of this information with our own communications team to try to break down the changes. And I probably could have done better to make it even simpler. So we found out that we need more protection with the Omicron variant. So the N95 masks, you may have heard that the federal government is going to release a large amount of these N95 masks from the stockpile into the public. We're still trying to figure out how those will be delivered, what avenues. I've read pharmacies, so we'll see. Hopefully we'll have more on that soon. But that's a huge amount of PPE coming into the communities. There also are, there are KN95s that you may have heard of. And I actually have KN95s. My husband and I use those. I buy them a lot. I give them to all of our children whenever they're visiting. They roll their eyes, but I give them to take them home. These are better. Throw that cloth mask away. When's the last time you washed it anyway? And the KN95s, simply put, are manufactured. They're N95s that are manufactured in China. So they still have to have a certain certification on them for them to be known as being effective enough. There is information out there about that. That's certainly something I can share. You can pass along, Carl, so that people can look. The ones I've done the research. They're good. They're fine. They're disposable, so they fit really well. The CDC, the most important thing they've said, because I'm sure a lot of you know that there was some push for the CDC to make a recommendation for different masks sooner than they did. In the end, the statement from the CDC that actually makes sense is that when you have recommendations that are a blanket recommendation for everybody, if I have an N95 or a KN95 and I am not wearing it properly, or I'm wearing my KN95 over and over and over again when it should have been thrown away, it's useless. It's so they're saying that wear the mask that you're going to wear properly, that fits you right, and that you're going to wear consistently and follow protocols on washing or whatever it is. So that's where they are. They're in anything's better than nothing. Now, obviously, I'd love to see everybody in KN95s or N95s. That'd be fantastic. But realistically, and especially in children, we're not really going to see that. So as Carl mentioned, a great alternative is the surgical masks, which I think are fairly comfortable. They're easy to come by. And then your favorite cloth mask over top. I'm sure we all have a collection of those by now. So as with everything else that involves COVID, it's ever evolving. So just mask up. Again, there are better masks. Some are better than others and more effective, but wear what you're going to be comfortable in. Just wear something.
During this current rush, have we peaked yet in our district, in the state of Virginia, with the infection rates?
So that's what I referred to earlier with UVA's predictions. I don't know yet if we peaked. The 51% fewer cases this week than last week is a great sign. So that's a 7-day window. So I'm pretty like, that's okay. I like 14 days. And if you look at firm rolling averages, like on the VDH dashboards for trends, 14 days is the gold standard. 7 is a good start, though. Don't get me wrong. But one of the things we never want to do, which we all do, I'm guilty too, is looking at cases on a daily basis. I report cases on every day, and it's more important to look at a 7-day average. So I also put together a report every week on Friday that shows the weekly trends. And that's really actually more important. But I hope we're getting close to peaking. I think that from everything that I'm understanding, the regions, the states that early on started spiking quickly, we're starting to come out of it, whereas other states, are starting to spike. So unfortunately, what that means is, most of us don't live within a county boundary all of our lives. We don't just stay in that boundary and live. We travel, we visit friends and family, we go shopping, we go to work in other areas. So what that means is, even if all of a sudden, which I don't expect it to be all of a sudden, but even if we had a great big decline right here, we still have to watch what's happening around us, not just in our backyard. Right. So we're watching, but again, signs so far are hopeful.
All right, here's another question. Will there be free access to masks for businesses that are trying to stay afloat, that cannot pay these exorbitant fees, individuals as well who cannot afford it?
So right now, I can't speak to how many N95s will be available to each of us individually, maybe businesses, perhaps for employers. There could be some grants available, some help for PPE in the form of grants from FEMA. Maybe these are just suggestions. I don't know for sure. Working in public health is a little different because our budgeting and our grants is just a little different. It's healthcare. So I can say that yes, I think that even the KN95s, which again I'm buying for my family from an online retailer, yeah, they're expensive. They're not cheap. I know that. And a cloth mask was, you buy it, you have it, you wash it. If it stretches out, you get another one. They're not expensive. So what I would highly recommend, surgical masks actually are relatively expensive and you can buy them in bulk. So again, as a really strong, good alternative, a surgical mask under a cloth mask is very effective. So that is something to think about and start with. But yeah, I totally agree that personal protective equipment can be expensive and it's unfortunate.
Iris, I'll tell you what, there are many organizations like Heart for the Community, Enough, and several that we work with. We're going to be partnering all throughout 2021 for as long as this virus is an issue to help try to get things like that to people. Hand sanitizer, mask, and things of the sort. So keep your eyes and ears out. I'm not sure exactly where you're located, but there are a lot of organizations working with local government entities that are doing our best to push this kind of stuff out. So I'm taking note of the things that you're saying, and you're helping me as someone who's busy in the community. You're helping me to understand what the community needs. Now, I want to ask a question. It may sound political, but it's not. We know that just recently we've had a new governor sworn in, which means we have a new administration at the state level. Have you seen yet, or do you anticipate any policy changes as we deal with COVID-19 that will affect us here in the district or statewide?
So I know you're aware of the Executive Order 2, which removed the mandates for masks in children K through 12. So that actually goes into effect officially on January 24th. And I know we all see in the news that there's certain, school districts who are saying different things about it. And I know there's a lot of very strong feelings on both sides about masks and children and schools. I am not aware of any other executive orders that apply directly to COVID-19 that would affect us as individuals so much. And honestly, if you think about it, our former governor, Northam, before Governor Youngkin came into office, Virginia, we haven't been locked down. We haven't had restrictions. We've been asked to follow guidance. And even now, we strongly, RAHD strongly recommends that we all follow the CDC guidance as far as transmission goes in your area. If the transmission is substantial or high, that you wear a mask when you're in public spaces, indoor public spaces. So they're still their guidelines, their recommendations. RAHD's stance has not changed with the executive order for schools. We still are following CDC guidelines, and we highly recommend that people wear a mask when they're in public to protect themselves and others, especially, again, because we're in such a surge right now of cases.
Oh, wow. This has been really, really good information. And we didn't get to not one graph. But you put out so much good information. And here's another question. Tisha asked, what happens if schools don't adhere to the new executive order for not wearing masks in K through 12?
That's a great question, Tisha. And that goes into my I don't know. I just don't. I deal with COVID and with information I'm providing, but I don't understand, the legal ramifications and if there are any for schools. So I think that's just going to have to play out. I follow the news just as much as probably most of you do, and it'll be interesting to see what happens. But I just don't know. Sorry.
Oh, wow, that's great. Hey, listen, audience, I want to thank y'all. Y'all have been rocking with us, and your questions and comments tonight are what make these type of sessions very informative and effective, because not only do we get to just put blanket information out, but we get to answer your specific questions. And I do hope and pray that this has been very effectual to you to this point, and I hope that you got your questions answered. Mary, I want to ask, you can take as much time as you like. Did we not cover anything this evening that you really wanted to put out to the audience?
No, I don't think so. I think everybody, your audience, as always, asks very, very thoughtful questions. And when I have to stop and think, or maybe look down and glance at my notes, that's a good thing. So no, I think we've pretty much covered everything. But anytime I'm available for people who want to reach out and ask questions, or if they need guidance on. Sometimes it's just knowing where to look for the right information. And the CDC, especially, they've such a wealth of information, but it can be hard to find things sometimes. So I'd be happy to help anybody if they want to reach out to ask for guidance on finding the right information.
All right. And for those who want to reach out, you can go to the RAHD website. That is the Rappahannock Area Health District, which is a portion of the Virginia Department of Health. And if you can't remember the RAHD, you can go to Virginia Department of Health, and they do break it down on their page for the health districts. And Mary is the information officer, I believe. I think I got it right. Public information officer for the Rappahannock Area Health District. Mary, once again, thank you so much. I think this is your third or fourth time coming on with us. And I tell you, I can't say thank you enough. You are a wealth of information.
Thank you.
And Tisha has said thank you. Iris has said thank you. And I believe that Rachel has said thank you also. People really do appreciate this information. It is golden. Thank you so much.
Of course. Thank you. And everybody stay safe.
All right. Wonderful. All right, you guys. Thank you so much for hanging with us. We really appreciate it. If you desire to see more informational shows like this, please let me know. Mary is very easy to get in contact with me anyway. She answers my emails. So if you want more information like this, let me know. And Mary, if there's anything that you want to get out to the public, you can send it to me and I will do my best to get it out. All right.
Absolutely. Okay. Thanks.
Until next time, y'all, have a good evening, and please do everything you can to stay safe. Bye-bye.
Bye.